associated with musculoskeletal and respiratory system are deconditioning, which means loss of physical fitness and exercise intolerance, osteoporosis due to the impact on weight-bearing joints such as knees and hips, increased body fat, which triggers the inflammatory process, deterioration of cartilage. Obesity can also be very hard on the kidneys, causing hyperuremia, which leads to gout, a very painful type of arthritis. Fat accumulation around the diaphragm can reduce chest wall compliance, increase work of breath, and decrease total lung capacity. Impaired mobility and flexibility, chronic low back pain, asthma, osteoporosis, gait disturbance, and soft tissue problems such as pain in the neck, shoulders, elbows, and wrists and hands.
Risks associated with poor cardiovascular health: chest discomfort, which is the most common sign of heart danger, tightness, pain, pressure, and/or throbbing, shortness of breath, pain, numbness, or coolness that can occur in the limbs if blood vessels in parts of body are narrowed, pain in the neck, jaw, throat, upper abdomen, and back, decrease in ADLs and physical activity, can possibly increase chances for depression, anxiety, and/or obesity, deterioration of muscles around heart, increased body fat, fat around functioning organs, which increases odds for diseases, and high cholesterol, blood pressure, blood sugar, fats, sodium, and triglycerides.
Improper nutrition, risks for poor nutritional intake, hyperglycemia. The increased consumption in a sugary diet results in sugar being converted into fatty acid, and with the help of insulin will get stored as fat in adipose tissue, which will result in obesity. Hyperlipidemia, our bodies are programmed to push excess fat into storage, which leads to gaining weight. Often the excess fat can build up into the bloodstream, which causes the levels of our fats and lipids such as cholesterol and triglycerides to rise at an unhealthy blood level. Weakened immune system. Obesity is considered a malnutrition consumption in the body, and because proper nutrition is proven to maintain a healthy immune system, obesity derails the immune system function. Poor diet can lead to adult obesity. Patients that are diagnosed with obesity are at risk for heart disease and stroke due to high blood pressure and high cholesterol, type 2 diabetes, and cancer.
What's your problem today?
Well, I'm feeling some tightness in my chest when I go up or down the stairs, and I haven't had a bowel movement in the past 5 days.
It's probably because you're overweight. Do you take any pain medication?
Well, I take Novolog before meals in my thigh for my diabetes. I take Lipressor 100 milligrams a day for my high blood pressure, and Lortab 6 times a day for my back pain.
Wow, you take a lot of medications.
Well, that's what the doctor prescribed for me.
What physical activity do you do?
I don't work out at all.
Why not?
Because my joints hurt all the time, and it's very hard for me to catch my breath.
You need to lose weight.
I'm so frustrated. I just don't know what to do.
Have you ever thought about going on a diet?
Yeah, of course I have.
If I tell you what to do, will you do it?
I'm willing to try my best.
Now we're getting somewhere. You can't eat red meat or things high in fat. Have carbs only 1 meal a day and go to the gym every day. Does that sound reasonable?
I guess it does.
Good. Come back in 3 weeks and we'll assess how you are doing and weigh you to document your progress.
All right. Knock.
Come in.
Hello, Mrs. Barker. My name is Mo.
And my name is Christina, and we will be your student nurses for the day. What brings you to the hospital?
Well, I'm having extreme back and joint pain. I am feeling some tightness in my chest when I go up and down the stairs, and I haven't had a bowel movement in the past 5 days.
I'm so sorry to hear that you're in so much pain. Why don't we work together to try and relieve some of your symptoms, okay?
Okay, thank you.
Can you tell me about your past medical history?
I have high blood pressure, high cholesterol, type 2 diabetes, and I have suffered from low back pain for the last 7 years.
Do you currently take any medications?
Yes, I take Novolog before meals in my thigh for my diabetes, Lopressor 100 milligrams daily for my high blood pressure, Prevolite 3 packs a day for my high cholesterol, and Loratab 6 times a day for my low back pain.
Okay. When did you notice that your back pain started to worsen over the years?
I've had back pain for the last 7 years.
Okay. And when did you notice that your weight started to increase?
I started gaining weight after my husband died 7 years ago.
I'm so sorry to hear about your husband passing.
Thank you. It's been hard to deal with it.
What did your diet look like before he passed?
My husband used to cook all of our meals. He was a great cook.
Did you and your husband work out together?
Yes, we used to run and go to the gym regularly, but now I get so winded so fast. I forgot what it feels like to be in shape.
Okay, one of the reasons you're having back pain and joint pain is due to excess mass on your weight-bearing joints. Cutting some fat will take some stress off your joints and relieve some of this pain. By adding some strength training into your regimen, your big muscle groups will support your body and put less stress on the joints.
Why can't I catch my breath?
The shortness of your breath you're experiencing has to do with excess mass that accumulates around your diaphragm. This inhibits the walls of your chest to move properly when inhaling and exhaling.
Gosh, I never thought of that. How can we do this?
How do you feel about mild walking?
I'm very interested in it. I really want to not be in pain anymore.
How do you foresee this change starting in your life?
Well, I used to walk with a friend when my husband was alive, but since he passed, she now comes over to my house every week and brings me food.
What type of food does she bring you?
Food has always been my comfort through this grieving process, but I loved the feeling when we used to walk together.
That is very nice of your friend to help you. But I have to say that fast food doesn't have a lot of nutritional value. It may be the reason you have been experiencing constipation. It's low in fiber, high in sodium, high in calories, and fat. This can be harmful to your body. The sodium can make your blood pressure even higher. The fat is stored and also can start clogging your arteries, which can lead to heart disease. Do you often eat fast food?
Yes, because it's convenient and easy for me.
Okay, so you're saying that eating out is convenient and easy for you?
Yes, I have no idea how to make nutritional meals. It's so frustrating.
Well, you're doing a great job expressing your feelings. There's a website called MyPlate that can help you understand how to break down your meals by nutritional value. What you need in a proper diet by recommended portion sizes that are reasonable. This website can assist you with meal recipes as well as making cooking more manageable.
Well, I feel frustrated that I've tried so many diets and they've all failed.
Well, MyPlate is not a diet plan. It's more of a national dietary guideline that aids in healthy eating. Changing your diet will benefit you in a great way. It will make you feel energized, boost your immunity, and help lower blood pressure and assist your digestive system.
Well, I usually microwave meals for myself. My hands get numb sometimes, and it's hard to use things. I started to notice the numbness in my hands about a year and a half ago. I think it happens when I get that tightness in my chest.
That shortness of breath you're experiencing is related to the blood flow to your heart. There could be some blockages there that we need to look into, but it can also be correlated to the numbness in your hands and feet.
Honestly, I feel relieved to know that this is the reason behind my pain. I thought I was going insane. What can I do on my end to help?
I think it's safe to say that we are happy to hear that you want to do things to help on your end. There is a lot that you can do, and this process of creating new lifestyle changes will be a slow process, but I believe in you. Change is possible with patience.
Thank you for believing in me. I've wanted this change for so long, for me to get motivated with all of my sadness.
Fabulous. More questions for us?
Yes, I think I want to get a gym membership. What gym would you recommend, and what workouts would you suggest?
We can actually give you some information about gyms in your area to reduce commute time. Swimming is actually a very low impact exercise that is very effective. Most gyms have personal trainers. I can get you some information regarding cost and availability as well.
Yes, please. I'd really like an accountability coach to guide me in these changes.
Well, perfect. Have your consent to share your nursing diagnosis, SMART goal, and nursing intervention with the class?
Of course.
Ineffective coping related to compulsive overeating as evidenced by easy access to unhealthy foods, fast food, and lack of knowledge in how to prepare nutritious meals for themselves, nutritional meals.
Patients will demonstrate basic food knowledge according to MyPlate dietary guidelines and give an example of how to prepare 2 healthy meals at home by the end of the nurse's shift.
Provide the opportunity to create an individualized, realistic weight loss program made by the patient and the nurse, which can allow the patient to enhance their food knowledge and voice emotions and concerns throughout the duration of the program.